When you're buying individual health insurance, you'll probably get overwhelmed by the prices and options of health plans online. Health insurance is now one of the more expensive items in the budgets of many people, but it can also be one of the best decisions you make if you have some know-how selecting the right health plan for you and your family. Here I will give you the 3 essential tips that I advise my clients to use when purchasing individual health coverage. Tip 1. Do not take health insurance advice from someone that is totally unqualified to give you this advice. I cannot stress this enough. It amazes me how many sensible people take advice about what health insurance to choose from people who are totally unqualified to give you this critical advice. For example, when I see health insurance messes, which I see virtually every day, and I ask where they got their health plan information, I inevitably hear things like, "My brother-in-law told me to choose this health plan. He used to work at the hospital." Or "I read an article that says this is the best plan available." And so on. Everyone's got an opinion about what health plan you should choose. Just because they are your relative, or involved in some area of healthcare totally unrelated to insurance, does not mean they know the answers to your individual needs and questions. Work with an insurance specialist before the problems come up. You have no idea how many clients I have worked with come to me after they chose health plan online and then have an insurance coverage issue and expect me to fix it. I want to tell them, you should have come to me for help before. Most insurance specialists get paid through insurance carriers, so their services are free to you. Use them. Tip 2. Determine your actual needs. The 3 things to keep in mind when determining your needs are budget, patterns of doctor and hospital visits, and prescription drug usage. Ask yourself these questions. How frequently do you visit your doctor? Do you go for checkups only, or do you go for sick visits? How many times have you been in the hospital in the past 2 years? Do you take regular prescriptions? What are they? Generic or brands? This is another area where most of my clients neglect. It is not possible to have maximum coverage in all of these areas in any affordable way. Maximum coverage for the doctor and hospital plus prescriptions leaves a dent in the budget. However, most health insurance plans offer more than one version of the same plan. For example, say you have Health Plan A that offers maximum coverage for the doctor, maximum coverage for the hospital, and maximum coverage for your prescription drugs. But Health Plan A costs the same as your mortgage. The good news is Health Plan A most likely also has customizable options, meaning if after analyzing your needs, you discover that you rarely visit a hospital, you could change Health Plan A's hospital coverage to moderate or even minimal, which will bring down the premium a great deal. If these options are confusing to you, again, a health insurance specialist will be able to help you. They are already aware of Health Plan A's customizable features and can match your needs to the appropriate version of Health Plan A. A health insurance specialist also has access to versions of health plans that aren't available as options to the average consumer buying health insurance online. Tip 3. Resist the urge to over-insure. After you've analyzed your needs, resist the urge to over-insure. One of the most common health insurance messes I see is over-insurance. People think that if they have maximum coverage for doctors, hospitals, and prescriptions, they have good insurance. The truth is, most people who will be approved for individual health insurance won't need all this coverage. 2 things I advise my clients to be aware of: healthcare reform and stop-loss. First, healthcare reform allows for preventive care services to be covered at 100%. For example, if you only get checkups, Why enroll into plan with 100% doctor's visit coverage? Enroll into plan with a lower premium and pay the $10 copay for your sick visit. The difference in premium with this small detail is $100s of dollars. Furthermore, some of these maximum coverage health insurance plans exclude things like pregnancy. The last thing you want to do is pay a small fortune for good health insurance only to discover it won't cover something you need it for. Second, most health insurance plans have a stop loss built into them, which basically states that when your out-of-pocket costs reach a certain amount, the plan will cover you at 100% for all services. And you don't need the maximum coverage plan for this benefit. Your health insurance specialist can even customize this stop-loss amount. Then, select your plan after following my 3 essential tips. 1. Do not take health insurance advice from someone unqualified to offer this advice. Seek health insurance specialist. They have studied and are licensed to offer this advice and they're free to you. Use them. 2. Consider your actual needs. Ask yourself questions so you know what your specific health plan needs are. That way you can make sure you select a plan that meets them. After all, if you don't know what you actually need in a plan, how will you know if you've come across the right fit? 3. Resist the urge to over-insure. Healthcare reform has changed how many plans work, and you may be able to receive ample or superlative coverage without over-insuring. And most importantly, without the hefty premiums. There you have it, online health insurance shoppers. I hope this was helpful.